I'm Linda Cooke. I'm an epidemiologist at the University of New Mexico, and I'm very pleased to be here today. And I'm going to jump right to the punchline. The punchline of this talk is that we are in the process of developing some prospective research resource, and we're hoping that other people would, who are in similar situations that we are, would also be interested in this and will work with us to build a resource. So that's the punchline, and I'm going to tell you a little bit very quickly about what we've been doing, building on what Candace has already presented. So we're using what's called the PCORI model. So this is Patient-Centered Outcomes Research Institute. I think most people have probably heard of this. What's unique about this particular research institute is that the research is done from the perspective of the patients. And so you make the patients are involved in the research process. They're involved in coming up with the research questions, and you do research that is of utmost importance to the patients, rather than this being driven from particularly an academic research environment. So what you have heard from Candace, that we have already started this process with PCORI. Our partnership is between Miners-Colfax Medical Center and the University of New Mexico. So we are following this model. We would like to hope that we can always follow this model because we believe that this is in the best interest of the miners. So kind of big picture stuff, we're kind of envisioning a consortium here, and we would like to think that we could form partnerships with our mining communities and health centers to get some large-scale collaborations going. This would include a lot of data and, we hope, biospecimens. And in this way, we could address a wide range of research questions. I'm just calling this the Mining Community and the Health Centers Consortium, just to call it something for the moment. And we envision that this would be a collaborative network of investigators and community partners, and hopefully this is going to lead to collaborative, coordinated, and interdisciplinary research. It's going to provide economies of scale, and it hopefully will provide opportunities to quicken the pace of research. So we also have thought about what would be the mission of such a group, and that would be to foster communication between investigators and stakeholders, to promote these collaborative research projects that would not easily be done within a single center or a single group, and to identify common challenges in mining health research and to develop solutions to address these. So what have we done in New Mexico? We have built upon the clinical service of the HRSA funding at Miners-Colfax Medical Center, which Candace just told you about. And we have taken this clinical cohort, and we're hoping to make it a full research study cohort. And we call it the MEN cohort. The MEN cohort is a dynamic cohort of about 10,000 New Mexicans. It's mostly minority men in rural settings who have been exposed to mining dust in New Mexico, and many have been followed for over 25 years. So we have a nice follow-up on these individuals. So this was also alluded to in the last presentation. In addition to the clinical questionnaires and the clinical testing that is done around spirometry and audiometry, and other things that are done. Someone had the foresight many years ago in this particular group to have a series of questionnaires, and Candace did allude to this. And in these questionnaires, we do have data on demographics, medical history, including heart disease, diabetes, cancer, and back pain, mining occupational history, non-mining occupational history, occupational chemical exposures, alcohol consumption, and height and weight, as well as tobacco use and consumption, not only smoking. We have also received IRB approval from our institution to start a prospective biorepository. So this would involve consent for biobanking and linking the clinical and the questionnaire and interview data with the biospecimens, in addition to banking 30 milliliters of blood and a spontaneous sputum sample. And as Candace said, we had also received Tier 1 PCORI funding, which is a joint project between Miners Colfax Medical Center and the University of New Mexico. And Candace has already told you about that, so I'm not going to repeat that. So no one is going to fund a biorepository these days. It's just not going to happen for prospective research. This is an environment in the research world where money is very, very tight. So to move forward in a process like this, we have to look at, very specific research questions and then where we can go for funding. It is possible that the Alpha Foundation would fund something, a research question related to a prospective evaluation. They will not fund a biorepository, though. I don't think that would happen. But they have competitions every year that it's possible to put an application in for. And of course, there's also PCORI. Next year, in 2015, there's a series of competitions that will come out for PCORI. Some of those are related to disparities. Clearly, this is a group that has disparities, whether it's being in a medically underserved area or being a minority group or a socially disadvantaged group. Certainly in terms of communication and dissemination research, there's application here. And of course, the assessment of prevention, diagnosis, and treatment is also very applicable here. This is just an example of some of the PCORI funding that's coming up, and I just wanted to give you an example, a few examples. So what do we think would be the next steps? We're not sure. We're certainly moving forward with this. We'd love to have some partners, and so possible next steps would be to establish a planning or a steering committee to identify a broad spectrum of the researchers and community partners who might be interested in such a project. Have a meeting, whether this is face-to-face or virtual, would have to be seen. And to identify some infrastructure needs, that could be a possible next step, and to develop strategic objectives. But most important, I think, to move something like this forward, we really have to have some research areas and research questions, because that's what's going to start funding for such a thing. And so we would like to have a very quick discussion about this. Certainly, if you have any ideas or would like to get in contact with us, there's my email, and you can certainly email me after the meeting as well. So we are interested in your thoughts. I'll leave you here with a picture of New Mexico. This is not a mining accident. This is actually a natural fire in the caldera near Los Alamos, and we just happened to catch it as the fire exploded. So maybe we can explode with some ideas here about possible research that we could do as joint efforts. Thank you. Yeah.
So Linda, for this wonderful presentation, as you said, money is tight. It's good to move forward. So one possible research idea that is of tremendous importance to me is...
Why don't you stand up and face everybody so everyone can hear you?
The search for a biomarker for lung disease in minors. Whether that biomarker should be the blood or the sputum, I don't know. And I know that previous searches for biomarkers in this population have all been useless. They've never really helped us. But our data is on CC16, which is a protein that's produced by the alveolar epithelium and is a marker of the integrity of the alveolar capillary membrane. And I know that the investigators at Lovelace Western Research Institute would be very interested in partnering in helping find biomarkers. The other thing that I can immediately think of is, the new lung cancer screening guidelines came out, and they've caused a tremendous amount of confusion in the minds of most clinicians, and I'm sure you may have something to say about it. So the low-dose CT scan and so firstly, the low-dose CT scanning guidelines were really not developed in occupational settings. They were developed in smokers. But to understand the attitudes of people and their understanding of what the risks and benefits are and how they apply to occupational cohorts, to me would be a very important area to look into.
Yes, I agree. I also think that, so you mentioned the Loveless Respiratory Research Institute, which is based in Albuquerque. They've also come up with a marker panel of DNA methylation sites, which predict lung cancer occurrence in smokers. And so one wonders, could this also be applied to, a mining community with dust exposures? Yeah, I think those are all great ideas.